Hello, I'm Kate Pagan, I'm the Chief Nursing Information Officer. The videos you will see next contain my friend and colleague, the late Dr. Paul Southern. He was the key driving force in the EPR programme and was passionate about patient care and safety and the way that it supports it. We felt that continuing to use these clips would be a good way to continue his legacy. I'm sure that he would be very proud to continue to be a part of this important programme.
Hello, my name's Paul Southern and I'm the Associate Medical Director for Informatics. In this short video we're going to look at how to prescribe an outpatient using Cerner. There's a few small hints and tips that will make this much easier. So the first thing to recognise is that unlike the rest of Cerner, when you prescribe in outpatients, it uses the computer's Windows printer to print. So this is slightly different to what you're used to when you're printing requisitions. So if we turn to the computer, how we check this is we go to the Windows Start button, we go to Devices and Printer, and you just make sure that the correct printer is attached to this device as a default. Now that might be the printer that's in your room or sat out in the nurse's room, and in which case you would right click it and select Set as Default. If there's no printers attached, like in this situation, if you set Pull Print as default, that means it'll send off to the Trust Pull Print system and you can tap into any pull print printer and retrieve your prescription. So how do we prescribe? So we go into the patient's record and we choose Requests and Care Plans, Add. I'm going to prescribe a drug called tenofovir. And as you can see, the order sentences offer up the correct dose. So I simply click it. And then the box is brought up here for completion. It's already predominantly filled in. So the things I have to answer are, is this patient's own medication? Well, no, this is a new drug. How many days do I want to give? In this situation, I give 180 days as it's a hospital prescribed drug, but in general, the default answer to that is 14 days. It's not a medication, not an admission medication. And then finally, two things I have to give. Does the GP continue it, which is GP to review? So maybe, for example, antibiotics, or is it a hospital prescribed drug, or just a short course, in which case you click no. Then finally, I have to give an indication. In this case, it's Hep B. We then click Sign. The system will recognise that this is an outpatient prescription. So it says, you've prescribed medication for this patient. Do I want to create an outpatient prescription? The answer is yes. I have to tell it where the patient should get the medication dispensed. So that could be at BRI outpatient pharmacy, it could be at St. Luke's outpatient pharmacy, or it could be a treatment advice note where there's no medication prescribed. But in this case, I'm going to say BRI, and I'm going to give my secretary's number as my contact details. I then click the little green tick to sign the form. I then, to actually produce the prescription, have to click on the Depart icon up here. As you know, within an inpatient encounter, this will bring up the electronic discharge summary, but here, this will simply generate a prescription. And I'm going to enlarge it so you can see it. There's the prescription, all the patient's information on it, including the drug, indication, how many days prescribed, and then simply I click Print. There's no further confirmation given, it just happens, and then close the document. And that's an outpatient prescription produced. So if we quickly go through that one more time, we add a drug. In this situation, I'm going to say paracetamol. I'm going to select 1 gram 4 times a day for pain. I'm going to click Done. I'm going to say, no, it's not the patient's own medication. No, it's not admission medication. I'm going to give 14 days. The GP is not going to continue it. And I don't need to fill in the fact it's for pain because that's already been filled in by the system. I'm signing it. I'm going to click yes. I'm going to once again say it's going to BRI Pharmacy, and I'm going to put my current number on it. I'm going to use the little green tick to sign the form, and then I'm going to go to Depart, and as you can see here, there's now the prescriptions being produced with both the tenofovir from earlier and the paracetamol that we've just produced now. Again, I will click it, and after about 20 seconds, Windows will bring up a little box that says print has been sent. The one other thing that it's worth recognising is that if you have not confirmed this patient's allergies during this admission, it will ask you to review and then confirm the allergies by clicking the Review All Allergies box and then clicking the green tick. The system will actually offer this box up for you. One other final point of note is that if you're requesting a complex or a restricted drug, so you go to Add again, and this may be a drug such as chemotherapeutic type agent or a disease modifying drug, so adalimumab, which is a biological drug. As you can see, the drug isn't there. If I click this search for additional items box, that will then bring up the additional items here. These are deliberately hidden because they're complex drugs. They may be investigational or trial drugs. But again, you can still prescribe in exactly the same way. But just remember, if you can't find the drug you're looking for, hit the search for additional items box, which will often bring that up. That concludes this video. Thank you for watching.